Welcome back to Tales of Truth, where we tell the truth about veterinary medicine. I'm Dr. Angie, and this is my co-host, JoJo. Today, we are talking about the connection of a certain type of cancer in cats with vaccines. Now, people often want to know if vaccines cause cancer, and most often we cannot correlate vaccines to cancer in cats or dogs, except for this one exception. And it bothers me that this isn't talked about more with veterinarians and their clients. So today we're going to talk about vaccine-related sarcomas. They have a million different names, and these cancers are relatively rare, but JoJo's cat suffered from a vaccine-related sarcoma, and that was so sad. Tell me more about that, JoJo.
My kitty did. When I was in college, I had Scottish folds, which I don't know if they're around anymore. I've never seen one in practice. So I always attributed the fact that she got cancer to her being purebred. But at that time, do I want to admit this? I think it was 22 years ago. 22 years ago. She, indoor only kitty, but we still vaccinated. We vaccinated for all the vaccines at once. So I believe we were doing leukemia, feline rhinotracheitis, calicivirus, the 5-in-1, and rabies. And all of those were given mid-scruff, which is like right between the shoulder blades. And she developed a little nodule is how it started. And they're like, oh, no big deal. It's just, a site reaction. But it grew so fast and so rapidly. And my understanding of that cancer is it's got a lot of legs. It grows and grabs on, and for a very lack of a better way to describe it. And because of the location of it, we weren't able to surgically remove it. And eventually it took her life.
Oh,
Yeah. Yeah. And I know
it's so
sad.
hard. It's so sad because we're doing these things to save our cat's life. We're trying to prevent rabies. We're trying to prevent leukemia. And we've known for a long time that there is a correlation between vaccines. We think it's more tied to rabies and feline leukemia. But 20 years ago, I will also own, 20 years ago, I was in school and in veterinary school. And at that time, we were taught that it was most likely the adjuvants. So the part of the vaccine that is causing the immune system to have a response. And so at the time, Marielle created these vaccines without adjuvants. They're now owned by BI. And what are they called, JoJo? They're
I
called...
was so afraid you were going to ask me that. It's
I
like
know this is...
Boehringer Ingelheim, something of
Oh
that
God,
sort.
I wasn't trying to make you pronounce that. Okay, so we
Oh,
won't.
I
We
thought you
don't
were.
have to pronounce. No, but what are the so Marielle created these vaccines, and they're called. They have a name to the line of the non-adjuvanted
Oh,
feline
yes.
vaccines.
Oh, isn't it funny when you put me on the spot how I don't know? And I do know.
PureVax. I know
Thank you.
PureVax.
PureVax.
Okay.
Yes, you're right.
So they had a line of feline vaccines without adjuvants. So they created this technology, and they had a 1-year rabies and a 3-year rabies, and feline leukemia and the rhinotracheitis, like all the respiratory viruses and panleukopenia. And they sold it to BI, which no one wants to say. I don't want to say that.
I'm sure I butchered it.
Totally. And so now they are owned by them. And so what's been interesting over time is that other vaccine manufacturers, other pharmaceutical companies have not adopted this technology. And I have some hearsay information, which is not trustable or valid, but that no one's been able to replicate these vaccines. And unfortunately, over the years, we've started to call them feline injection site sarcomas. And so now we're trying to say, well, it could be any injection. And that, I have to say, really makes me suspicious, and it irritates me. Because other other injections, like for giving sub-Q fluids or for giving an injectable antibiotic, we are still using the same space, like in between the shoulder blades. But for vaccines now, we are vaccinating as low on the leg as possible so that if a kitty gets a vaccine-related sarcoma, I'm still calling them vaccine-related sarcomas, we can amputate the leg. And I feel like this is so important. And when JoJo and I were making house calls, I would often say it to people out loud because I felt like it was important for people to understand that that's why we are now vaccinating. Like, here, I'll point to my cat.
Really low.
Right there. We're vaccinating right there so that if that vaccine causes a sarcoma, we can save that cat's life by removing a leg. And most people don't know this.
But I think even that conversation, I watched people's response to that and just the surprise that they had no idea that it could be an issue. Like it had never been explained to them before. And the idea of amputating anything is so scary. So I think in that moment, vaccinating their cat becomes a very real procedure and not just a routine procedure. I also noticed because my own sensitivity to it, I wanted to get so low on that leg. So I was so grateful when they came out with 0.5 ml vaccines, instead of a whole milliliter that we had to get into that little sub-Q space.
Right. Yeah, because the lower we go down on your cat's leg, the less space there is underneath that skin. So the nice part of being up here is that, or here. Oh my gosh, it's really hard to do this.
It's there. There. It's like pin the tail on the donkey. For those who can't see it, those are listening, she's pointing to a cat on the wall.
Oh yeah, thank you. So there's so much space, it doesn't hurt. And now we're even vaccinating in tails because we can also amputate a tail. And now, like JoJo said, a lot of manufacturers are starting to make vaccines with less volume. So usually vaccines are 1 milliliter in volume. And now they're a 0.5 milliliter, which makes it a lot easier.
So much easier. Yes.
To
and the kitty, because most kitties are not real thrilled to have us doing this.
No way.
And now we have shrunk the space in which we can inject this, making it a little bit more complex. It often took 3 of us. Like we would have to use you, myself, and the cat guardian just to make this happen. It's become a whole thing.
I know. And when I was first out of school, I would vaccinate all my cats in the practice I was working at with 25 gauge needles, which is like really small. And I had this week where I had 3 vaccine reactions, like cats going home and being really sick. So I called the vaccine manufacturer, which I was using Marielle at the time. And they were like, someone there, I don't know if it was the rep, I don't even know if it was a doctor, but they were like, hey, stop using 25 gauge needles because when you're putting the actual proteins through the needle, it's too much at a high velocity. And so maybe you're making things more reactive. I've since loosened up on that. Now that I'm doing relief, there are a lot of practices that are doing 25 gauge, and I'm like, well, I'll go with it. And so far, it's knock on wood, it's been okay. But it really, like, the lower we get on the leg, the harder it is.
And remind me, we did a tail one. Did we do a tail injection in practice? Only once.
Yeah, only once, and it feels gross because you're touching the bone with your needle. And there are not too many times I really want to be touching bone with my needle. And so although I have to say, I don't know that the cats mind them that much. I think I minded it. Have you done it on the tail before?
I had not. I watched, this is how I learned that, was watching videos, right? Because we did not learn that in school. And I remember telling you, you're going to do this one. This one's on you. Let me see you do it first, and then I'll try. But honestly, I think it would be just as difficult or as easy as doing the lower leg.
And every cat's tail is so different. And there's, anatomy, like, how much skin they have, how much subcutaneous fat they have. It all is pretty different. But I think it's really important for people to understand that there is a risk in vaccinating your cat, and that there is a type of vaccine out there that lowers that risk, whether anybody wants to admit it or not. it must lower the risk. I have some sensitivity as to why the American Association of Feline Practitioners aren't recommending only non-adjuvanted vaccines for cats. That seems crazy to me. And so I don't have any proof, but I think that there's money and the pharmaceutical industry behind this. And I'm not against the pharmaceutical industry, but there's just something doesn't quite line up for me. And I think if you are vaccinating your cat, you want to make sure, one, that your cat needs that vaccine, and two, that it's going low on the leg, and three, that you're using the non-adjuvanted vaccine. Because if it lowers the risk of your cat getting this sarcoma, which is very aggressive, and that's why JoJo's kitty, like, there's nothing they could do because they can't surgically remove it in the scruff, because this type of sarcoma, like JoJo said, grows fingers and is so invasive into the tissue that there's no way to kind of peel it out, and it grows so quickly.
Yeah, I didn't want to do that again. So if I go backwards in time, the mistakes that were made. So if we could educate the next cat guardian, one was giving all the vaccines at once. So we have no idea what kind of reaction, which one she was having a reaction to. Whereas if we had pieced them out, and the way we do it in practice is we space them out by 2 weeks minimum. So one injection, 2 weeks later, we can give the next, which allows us to know, like, if there's a reaction, we know exactly what that kitty reacted to. Plus, I'm sure it was so hard on her system having all of those vaccines introduced at once. The location would do that differently. And evaluating what was necessary, given that she was indoor with living in Los Angeles at the time. She was having no risk. We weren't having bats in the middle of the city.
Right.
So
And
really
she
having that
definitely
dialogue.
she didn't need feline leukemia if she was inside.
Oh, not
Yeah,
ever. Like, we
I
weren't introducing
know.
new cats. I think the reason I did do leukemia is because I was in school and engaging with a lot of other cats. So there was always the fear, like, what am I bringing home? And I know that that's not, just a lot of not knowing, a lot of fear based.
Oh, yes. Well, and I think it's really important of, like, okay, taking the disease, knowing if your cat is even susceptible to it. Feline leukemia is a little bit harder to get. Cats have to be together. They can get it from their mother, or they have to be in a lot of close contact. And so the more we find out about the transmission of feline leukemia, the more it irritates me how often I see clinics just giving it, because
Well,
just in case. And I just think, ooh, I don't think so. Now, we've definitely in our practice seen a lot of really good reasons to give feline leukemia, like a cat that's outside and super social with other cats. That makes
uh-huh.
sense. Like, if they're buddying up to other cats that are outside, that cat is an excellent candidate. Or we've had clients that foster kittens in their home with their other cats. I think that's an excellent time to use the feline leukemia vaccine. But other than that, I don't see a lot of use for cats that are in a closed system that aren't getting out. I think it's, I just don't think it's good. Now, I'm a huge proponent of vaccinating for rabies, especially cats that are going outside, cats that are going to be around open water sources. Like here in the Front Range, we have bats that have rabies, skunks. And so if your cat's outside, the risk of rabies far outweighs the risk of that vaccine related sarcoma. And so I want everyone to understand that you should absolutely vaccinate your cat for rabies, low on the leg and with PureVax, in my opinion. And so I think it's these conversations that aren't being had. And now that I'm back out in a lot of different hospitals and private practice, there's not enough time. And so we have nurses going into rooms and saying, here's what we have, here's what we recommend, yes or no. And either there's a lot of guilt, and so people get really defensive about, like, if they don't want to vaccinate, that conversation's really difficult because I think they feel so judged.
Which is a
They,
whole conversation.
yeah.
Well,
And so I
let's
think,
go further into that if you don't mind. Like,
yeah.
in terms of, we also run into the issue with our clients who have indoor only kitties who we've maybe not recommended rabies for because they have such a low risk of exposure, but they cannot get care in a brick and mortar clinic without, they mandate a rabies vaccine to be seen for
Right.
routine care. So
Right.
that is an issue. And I wonder what the reason for that is. If it's, maybe you have a better scope on why clinics would make that mandatory.
Yeah. So I think clinics are making that mandatory because on the other side of that, so if that cat comes in and bites, which I mean happens, I feel like cats maybe bite a little bit more than dogs. Is that safe
I,
to say?
I well,
Depends on the dog.
I'm like, yeah, let's talk about, like, is it chihuahuas or is it, what are we talking about?
Right. And so if we have that bite, so then like someone's bit, a nurse, a doctor, a client service representative, someone takes a bite, then it becomes reportable. And then, once it gets reported, if it gets reported, then, we want to know, did that animal have a rabies vaccine? So it becomes this nightmare for the staff in the clinic and for the hospital manager. And so I think most clinics are recommending it or mandating it because it just makes, so then that bite happens, and if it's not that bad, then everyone kind of goes on about their day. Kitty doesn't need to go home and get, quarantined. It's just, everything gets easier. So I think that's why they're recommending that and why
Which
they're
is
mandating it.
understandable. I can understand. Again, here I am. I can understand both sides of this. Um, I can,
Totally.
having been bit by a cat, I can certainly understand that. But I wish there was a different way. Like, if
I
that cat bites,
know.
can we titer? Can we? I mean, are there other options that we can do? And we've seen them. They've put them on quarantine at home before.
Yes. Yeah, we've
Because
definitely seen that.
the chance that that cat has rabies is so low, so low.
I
But that's
know.
that
And
fear
what's
piece, right?
interesting.
Because you're going to vaccinate for
Yeah.
rabies if you are fearful that they're going to put your cat down if your cat bites.
100%. Yes. And what I have seen in the state of Colorado and what I've seen in the counties around Denver is that if I were to call and say, like, remember we had a client, I won't name any names,
Uh-huh.
who told me, hey, I've been feeding this feral cat and it bit me. And I was like, oh, like I was terrified. So I called and I reported it because as a public health officer, like I absolutely have to do that. So I called Boulder County and I was like, I just want you to know this has happened. And they're like, I mean, we don't care. And, because I thought maybe they'd want to go trap the cat, quarantine something, some kind of follow up. And I really wanted, if our client needed post-exposure. So basically, if you get bitten by an animal and we're not sure if it has rabies or it doesn't have rabies, you can get post-exposure vaccines to rabies so that you don't die. It takes a long time to develop rabies. And so if you were exposed, we can absolutely prevent your death. And so in my mind, I'm like, okay, I'm preventing this person's death just in case. And the Boulder County just was kind of like, we really assess cats to be low risk to carry rabies.
Uh-huh.
And so it gets to be really, really confusing. And I'm not saying that Boulder County made the wrong call. They just maybe don't have the resources or didn't feel like they needed to go do something about it. And
Well, and
so,
that's the nuance of it, right? I think every time you are evaluating whether or not to vaccinate your cat for rabies, it's going to be a different dialogue at every stage of life. Um,
yes,
it's not a one-time decision, and you can change your
that's
mind at
so
any point.
important. Yes. Well, and it can change from month to month, year to year. Your situation, your living situation, what other animals are coming in and out? Are there children? Are you like, it's nuanced. And I understand why clinics have these kind of blanketed vaccine policies. But one thing I've really loved about our practice is that we get to have all those nuanced conversations and then we get to let people decide how they want to vaccinate.
Right? Yeah, there's so much
Yeah.
that goes into play. Their own risk tolerance plays a role. Like, that's not something that you have room to have dialogue about in most practices. And
Oh,
here's where I go on my limb of like, here's my theory around this is, I mean, vaccines are moneymakers in terms of it gets you into the clinic, right? So if you're coming in every year for this, it's an easy, not that that's why we are administering vaccines, but it definitely gets people into the clinic, which is
yes.
important. That's an important piece. Without the vaccines, people may not consider bringing their pet in until they're sick. So you might miss out on those wellness exams.
Totally. I worked for a practice when I was first out of school, and they did for dogs distemper parvo. They did it every year, and I kept telling them, like, I'm like, listen, we don't need to do this. I'm a new grad. I know everything. And now the guidelines are every 3 years, and I think that this is malpractice. And the practitioners were much, much older than me and had been practicing for as long as I had been alive. And they said, yes, I hear you. But when people get that vaccine reminder, they think, okay, I am going to equate being a good steward of this animal to keeping them up to date on vaccines. And so there's this whole culture of like, yes, my dog or cat is up to date. They're good. And the veterinarian said to me, he's like, this is how I can catch the lump. This is how I can get,
Uh-huh.
tell them that their pet has painful dental disease. And it was eye-opening for me to kind of get the other side of like, yeah, it is a moneymaker, but it's also a way people want to comply.
Uh-huh.
And we can get people into the clinic for the other care that they might not even know their pet needs.
Especially cat people, particularly cat people,
Especially.
especially indoor cat people. Yeah,
I know, because cats don't get enough veterinary care
they don't.
because it's so hard to get them into the clinic. Sometimes it doesn't go well. No one likes the sounds their cat is making on the way to the clinic in the carrier. Maybe they've peed in the carrier. Maybe they've hid under the bed for like 30 minutes before once the carrier came out. Like we could do a whole episode on this.
I'm going to write that book. Uh, I have another question for you while we're still on this topic. Um, what is your perspective or your thought on knowing that Marielle makes a non-adjuvanted vaccine?
Mhm.
Why would not every clinic carry that vaccine? What would their reasoning be for not having that brand?
This is so good. Well, it's BI now because Marielle. Oh, does
I'm
Marielle even
so sorry.
exist?
Yes,
Yeah.
it is
Yeah.
BI.
BI bought Marielle. But yeah,
Yeah.
why doesn't every clinic, most clinics don't carry it? I will tell you as a relief that I would say most don't, because it's expensive.
Uh,
And it's not that they're necessarily like, oh, we can increase our own profit margin. But these PureVax, the PureVax line is more expensive because the technology is, more expensive. And so people don't want to pay for that. And so at the end of the day, as public health officers, veterinarians are like, well, I want my patients to be vaccinated. And so however I can make that easiest for the pet parent, that's what
uh,
I'm going to do, which is a
uh,
bummer.
that is a bummer. So when I hear, as we wrap this up, as a cat guardian, if you are a cat guardian, the questions you should be asking are, where are you administering the vaccine? Which vaccines does my cat really need based on our lifestyle and risk? And what vaccine manufacturer are you using? Like those would be good questions. Am I missing any?
No, I think that's right. Yeah, make sure your cat needs it. And if we're talking about vaccine related sarcomas, so there is a 3-year rabies vaccine and a 1 year. Now, when you first start your cat out on the series, no matter what you give them, it's only licensed for 1 year. That's how it is in Colorado. I'm sure that's how it is in most states, to be honest. So that first time you give your cat a rabies vaccine, it's only going to be licensed for a year. But after that, get the 3 year. So you're doing less actual injections, actual moments where you're injecting a vaccine into your cat. So I recommend people doing the 3 year
Is
whenever
the
possible.
3 year more? Are they getting a larger dose if they're getting a 3 year over
Yes.
1 year? And
Yes.
that would still be your recommendation.
I think so. Yes.
Yeah.
That's what I finally did. And that's what I settled on for my kitties is that I'd rather have that than do it every year. And it's so much easier for
I think your
everybody
cat would
involved.
too. Prefer just to,
For
and if
sure.
you, yeah,
Yeah.
especially, oh, and try to really make sure they only give one vaccine per visit. Which
And
that's a challenge though too. If you're going into clinic and you have a cat that does not
I
enjoy that.
know there are some times where I think but so they do it in separate sites. So they do
Uh-huh.
usually rabies on the right rear and then FERCP on the left rear. Or they usually and so if you have to do them, just make sure that they're putting them on different sites, which most clinics these days are. But I like to space things out. I'm sensitive. I like to keep, I assume that my patients are sensitive, which maybe sometimes isn't the best, but if we can space them out, I do. And especially if you're giving your cat FERCP and rabies and they're every 3 years, I'll try to stagger the year if I can, or stagger it by 6 months or something like that. But it really
And,
depends on your kitty.
and only vaccinate healthy kitties, not on
And
a sick
only
visit, ideally.
yes, those vaccines are labeled for animals that are healthy. We study them in animals that are healthy. And so when we vaccinate sick animals, then we don't really know if they're getting a good immune response. Their body's busy doing other things. There are a few times where I would do it, but it's very, very rare.
Great.
Anything
I keep
else?
thinking of things that I'm like, oh gosh, and not too young and not, you know,
I know.
not too
I know. We should
early.
do more episodes on just vaccines in
Uh-huh.
general and how to help people decide. But I think for cats, you just want to make sure you're doing the vaccines that your kitty needs, that they're doing it low on the leg. And I mean, hopefully they're using BI vaccines, but if not, make sure they're doing it low on the leg. The odds of your kitty getting a vaccine related sarcoma are very low, but that doesn't matter when it's your cat. No one feels better when I tell them, this is really rare. I'm sorry it's happening to you. It doesn't
Uh-huh.
matter. And so
Right, because once it happens to you,
once it
you
happens to you,
wish you would have had the knowledge so you can do better. So I
yes,
hope that's what this episode does, is just provide the knowledge
yes.
because we don't know what we don't know.
We don't know. And veterinarians just don't have time, and veterinary nurses don't have time to go over all of these things. And I think most pet parents don't want to know these things. Now, if you're listening to us or watching us right now, you're not one of those, but I think most people just want to, tell me what to do. I need to move on with my day. I need to get back for a meeting and
Mhm.
let's move on. But if you want to be conscious about what you're doing and you want to know the truth behind why we're doing what we're doing, this is it. I would love to hear your story about how you vaccinate your cat. So you can leave a comment below this post, or you can find us on social media. We're Boulder Holistic Vet on Instagram and Natural Cat Vet. You can find us either place. Thank you so much for listening, JoJo. Before we go, is there anything else we should mention?
No, I just think this was such an important conversation. I'm glad we had it.
Yeah, thanks so much for hanging out. I always love it. Dr. Angie again here. And as a PS to this episode, I wanted to let you know that I created a course outlining my approach to vaccines in cats. You can get it for free by going to my website, boulderholisticvet.com. Go to my courses page and you can use the code TruthTales at checkout to get it for free. That's TruthTails. See you next time.